When caring for others, incidents are an unfortunate fact of life. Falls, injuries, and medical emergencies are just a few of the many different types of incidents we may encounter. During this video, we will be discussing incident reports, an important piece of documentation following an incident. We will discuss when and how to fill out an incident report, as well as important tips for you to remember. In its simplest form, an incident report is just a piece of paper. But of course, you know in reality it is much more than that. An incident report is a valuable piece of documentation that, when done properly, will document what happened, what was the incident, what you did about it, your interventions, as well as the subsequent condition of the person you're caring for. Now keep in mind, an incident report is different from your narrative documentation or charting that is done in the person's record. Be sure to check your policy on incident reports and understand it thoroughly. In addition to providing valuable documentation, in virtually every state, incident reports are a licensing requirement. Your state regulations will dictate when and how an incident report is to be completed, as well as to whom it is to be submitted to. This could include your state licensing agency, the individual's family, and others. We'll talk more about this later. One of the most challenging issues regarding incident reports is knowing when to fill one out. The best rule of thumb to follow is, when in doubt, fill out an incident report. If in the back of your mind you're asking yourself, does this incident that just took place warrant an incident report? Chances are the answer is yes. While there certainly are pros and cons to incident reporting, generally speaking, you're better off having filled out an incident report than you are had you not. But let's talk more specifically. State regulations generally tell us that any time an incident threatens the individual's health, safety, welfare, or rights, an incident report is to be completed. Let's discuss some specific examples of when you would fill out an incident report. Following any injury. This could include cuts, bruises, broken bones, head trauma following a fall. Anytime the individual you're caring for is injured, you should fill out an incident report.